Welcome, everyone. Thank you for joining us on this webinar, When is it time for home care? My name is Nicole Christensen. I'm the CEO and president of Care Answered, which provides patient advocacy and care coordination. We get care done. So how we do that is we navigate people through the healthcare system, through transitions of care. And some of that is what kind of care do we want at home? So we have lots of experts here for you to help bring more information to you. And as always, it's our Care Answered family, people that we work with and trust, and we've had clients work with and have wonderful results. And so we wanted to be able to share their expertise with you. And I'm so excited that they came to be with us. As one more thing about myself is I'm also the author of the book From Crisis to Calm. And so that's for all caregivers. So if you're interested, please contact me. So what we're going to start with is our wonderful sponsor from 101 Mobility. And she is Kim Kussler. Can you actually pronounce your name correctly for me, Kim?
It's Kester. It's okay.
Kester. I know it's wrong when I say it. It's Kim Kester, who's going to talk about all the wonderful advantages of 101 Mobility to keeping somebody at home and making it safe for them. So without further ado, I'm going to have her take it away. She has a short video for us as well.
Good morning, afternoon, everybody. I'm usually saying good morning. Kim Kester from 101 Mobility. I'm the owner in Farmingdale, Long Island, and we take care of all of Long Island and Queens. And when I say we do home modifications for anyone deciding to stay at home and age in place, people generally say, like what? The best way to show somebody is through a picture. So I oftentimes share the 1-minute video. I send this by email all the time, and it's just something that's very helpful for people to see. So I'm going to play this. Are y'all seeing this on your screen? Please say yes. Does anybody see this on their screen now?
No, we don't see it yet.
Okay, so we'll try again, multiple, and okay. There.
There it comes.
Yeah, looks like it's gonna load.
There we go. She's loading. And do you see a large gray house right now?
We do.
Yes.
Fantastic. Okay. So now I can simply push play, which is underneath. There we go.
We work hard every day to deliver the best mobility and accessibility solutions for people that are faced with limited physical mobility and their caretakers that help them. That's why we offer free consultations where one of our experts will meet with you in your home at your convenience to help determine the best solution for your unique needs and limitations. Whether you need a stair lift to help you get up and down your home stairs, a vertical platform lift to bypass stairs or provide access to porches and decks, or a ramp to overcome steps and thresholds, we have a solution to fit your needs. Contact us today to speak to a local mobility expert and schedule your free home consultation.
So those are some of the examples of the modifications that you can see. Can you see me back again?
Yes.
Okay, good. Fabulous. Those are some examples of the modifications that we can make to the house. We really we work across Long Island. I keep things small in my home warehouse at in Farmingdale. There's the offices along with the showroom and the warehouse that holds all the ramps, the chair lifts, and that which is able to be modified in your house within a week. So we are able to keep everything there in the warehouse in order to get to you as quickly as possible. Our typical phone call is mom is being discharged from rehab and we need a ramp to get her into the house and a stair lift to get her upstairs to her bedrooms. And that is, we can do that within a week and a half a day. And I oftentimes speak about our caregivers because every bit as important as the modification we do for the house for the person being cared for is the person who gives the care. Because ultimately, I mean, my own personal experience, I was the caregiver for my dad, 6'5", 280. That's not fun. But it starts as, a rest on the arm to go up the staircase until you don't realize you're piggybacking 200 pounds, bringing, assisting. So that's really, these are different modifications tools to make sure that everybody stays safe in the house. So Kim Kester, 101 Mobility. I can actually modify this. My email in Nicole always knows where to reach me. And these guys have just been fantastic to work with. You are amongst trusted friends when you speak and hear all of us. So thank you for your time. And thank you, Nicole.
Thank you, Kim. Thank you for sharing that information. It's so helpful. Now, let me just ask you, do you serve the city at all?
I do go, Queens, absolutely. I will go into Brooklyn, the Bronx, New York City. It depends upon the different things that are needed in the city. I do a lot of elevator installations. I don't do them in New York City because the Department of Buildings has made restrictions too difficult. I do tub cuts in New York City because of the age of the buildings, and people's bathrooms don't have showers, they have tubs, and we do a simple tub cut. And I will do them through apartment buildings. So I'll do 10 of them. So yes, we do go into the city. It's more complicated, but that's okay.
And I know you do a lot of tub cuts, and that's been very helpful for clients that
Yes.
I've had and other folks as well. So just
Yeah.
great to work with you. So thank you.
Well, same as you, Nicole. Everybody, I'll stay on the line in case anybody has any questions and put my email up here against my name. And
In the
I'm
chat.
here if you need a question.
Perfect. Thank you so much.
Sure.
So with that, we're going to move on to talk about some of home care. I'm going to begin to talk about home care that is really covered by Medicare Part A for the most part. So what does that include? A lot of people get confused about this. They think, okay, my spouse is leaving rehab, for example, for physical therapy, occupational therapy, speech therapy, and they're coming home, and we were told, or they're coming home from a hospital, we were told that we were going to have an aid and home health care. That is temporary. So let me just talk to you a little bit about that to define it so that you're aware. So for the purposes of home health care covered by Medicare, one is considered homebound based on the Centers for Medicare and Medicaid criteria, often called CMS. So what that means generally is they're required skilled care. Hold on one second. Let's just, if we could all mute ourselves.
I guess she's the director of social services.
Hold on one moment.
Mana Saraju.
Okay,
Her name
I
is-
think we've muted her. No. Can we all mute ourselves? Thank you so much. I appreciate it. So requires skilled care on a part-time or intermittent basis to improve, maintain, prevent, or further slow your health condition. The person must be under the care of a nurse practitioner, clinical nurse specialist, physician's assistant, or doctor who completes and documents an in-person visit. That's generally the case still. However, you have to be under a clinician's care within the last 3 months, or at least within a month after you received this home health care. This is generally, as I mentioned, put in place after hospitalization or skilled nursing rehab. But if you feel you need this kind of home health care that we'll talk about in more detail, you can also ask your primary physician to prescribe it. So there's acronyms that we use in every field of work. And one that is often heard is CHA. And that is what is covered under home health. That's Certified Home Health Agency, I believe. See, I don't even remember all of the acronyms. But what is covered under that home health care? So skilled nursing care and rehabilitative care services from Medicare approved home health agencies. So when we say home health care, we're actually including physical therapy and occupational therapy, speech and language pathology services, medical social services, medical supplies, and other services provided in your home. So it is somewhat holistic. They definitely do give some limited time of a home health aide that is limited. And oftentimes you'll get, an hour or 2 hours, maybe 3 days a week to help with showers, because that is not essentially what they cover. There definitely have been exceptions. I've worked with people to get more hours through their Medicare, but it's not the norm, and it's definitely not long-term. As you'll see on this slide, Medicare is not for long-term. So I'll just read it to you. Medicare's home health care benefit is not a long-term service and support program, and it does not provide unlimited coverage. So if the care includes 24-hour care or meal delivery or homemaker or personal care, Medicare generally will not cover that cost. Okay, and so we have some great speakers and presenters with us today to speak about the other kinds of coverage that would be most beneficial for after that short period of time, or in addition to that short period of time of being discharged and having some Medicare coverage. So I'm going to stop sharing my screen because now we're going to have a fun conversation. And I'm going to, so who we're going to speak with is Melanie and Maureen. So Melanie and Maureen, I would like for you to introduce yourself because I actually stopped my share a little too early. Hold on, let me just put this up so that you guys can see it at least. So we have Melanie from Allegiant Home Care, which is an Accord Care company. She's the area manager of business development. And we have Maureen Nickel, a CSA and owner of Bright Star Care of North Shore, Nassau County. And they're going to speak with us about the ins and outs of when is it time to get home care and what it is. So I'm going to start with Maureen, if that's okay, Maureen.
Yeah, absolutely. So
Okay.
Did you have a first place where you wanted to start, Nicole?
I did. So when we talk about this first time to start, I talked a little bit about Medicare. What do you see often as the really good time to start to think about and or to utilize home care?
Okay, great. First of all, thank you, Nicole. Thank you for having us. As Nicole said, I am Maureen Nickel, the owner of Bright Star Home Care. And we see many, many phone calls come to us as mom, dad, your loved one is being discharged from rehab, from the hospital. Some people bypass rehab and come right home, depending on their level of skill, mobility when they discharge from the hospital. So we get an awful lot of those phone calls we need to start home care now. We also have, and I would say it's probably only about 20% of families that will call us and say, Mom really doesn't need home care yet, or the person themselves, I really don't need home care yet. However, I don't want to be in that crucial situation where I have to find it. So is it possible to have a home health aide come to my house 2 days a week for maybe 4 hours to take me grocery shopping, to help me around the house, just very kind of companionish type care? And we applaud those people. We think that's wonderful because then you're not in that crisis mode. But again, that's very, very few. Bright Star is one of the few agencies also, we service Nassau and Suffolk, that still takes the small hour cases. Most agencies take 6 hours and above. We are a joint commissioned agency, which means it's the highest level of accreditation. And one time Joint Commission had suggested that Joint Commission agencies only do 6 hours or more. And there was a lot of pushback on that. And I'm glad that didn't go through because some people don't need a whole lot of care yet. So we will start that conversation with people. If we have the short hour aides available, they'll go in and they'll just do very limited types of work. They will they'll do the driving. We do drive, our aides do drive clients around. We'll help them with housework, and we don't have any real personal care needs. And I don't know if you wanted me to get into that yet, Nicole, the difference between companion, personal, and skilled type of needs.
We'll talk about that in a little bit.
Okay.
Absolutely.
Okay.
What have you seen? Obviously, you own an agency, but you can speak without bias on this, of the pros and cons of hiring from an agency versus on your own.
So if you hire privately, it is considerably cheaper. I just have to put that right out there because I took care of people in my own family years ago, and I'm not even sure back then we were aware of agencies. We just did private hires. It's considerably cheaper because it's your out of pocket. There's no insurance or anything else involved. The problem with it that we always came across as a family was that when that aide needed time off, what do you do? Are you training them, or did they come in with some background? What were they trained? There certainly isn't any nurse attached to them for you to call when something else kind of happens. You're kind of on the phone with the doctor, and sometimes you like to have that intermediary to help you out if it's not a huge problem. So that was some of the problems that we ran into, training somebody ourselves, and were we best equipped to train them? My father had a catheter and there were problems with that. Were we able to always find somebody? Well, one of us, staying home from school, we were young at the time, staying home from school to take care of this person when the aide did need time off. So that's one of the problems. And I think by telling you the problems, you also get the gist of what the pros are. The pros are you have dealing with a licensed agency. Licensed means we can do any level of care we can do. It's not a companion agency where we just take, your loved one out to local shopping. We have to do the personal care under New York State license. So we can bathe, we can shower, we can toilet them, we can feed them, dress them. So we can allow to do a full level of care, and they're people who are trained. The biggest problem in a home is people being transferred from bed to wheelchair, from wheelchair to the car, to go to a doctor's appointment. And if you don't have a trained person there, you run the risk of their falling. That's one of the biggest problems with untrained, aides. They haven't been trained with the body mechanics of how to get a big person. Kim mentioned that her dad was big. That's one of the issues I go through families all the time. They'll say to me, don't send me a little aide. Don't send me a little person, And when you're equipped to be able to train, to be able in body mechanics, you're able to be a little person and still handle getting a bigger person transferred from, bed to chair, whatever that may be. So the biggest, I see personally, the biggest advantage to having a licensed agency is that you have a 24/7 nurse on call. And when I say 24/7, I mean 24/7. I had a case one day last week. I think it was the weekend, actually. I think it was Saturday morning, where a daughter called and said, I do not know, they're clients of ours. I do not know what's wrong with mom, but she's not acting herself. She's saying a few crazy things. Now, early onset Alzheimer's dementia does not come on quickly. When it's a sudden delusionary type behavior, very often that's a UTI, a urinary tract infection. The nurse was in the house within an hour and a half. She was able to get a specimen, run it to the lab, call it into the doctor, get a prescription of Bactrim, bring it back to the house. The daughter never left the house. She's still calling me 6 times a day to thank me, for that. So that's one of the benefits. You have a certified aide, a trained aide, trained through the state of New York. We do additional trainings. You have a nurse 24/7. And you don't have the liability issues. If an aide should fall in your house, we take care of all. We're licensed, bonded, insured, trained aides. But no doubt, it definitely is cheaper if you do it on your own.
Absolutely. And I just want to add to that, and I know Melanie would agree, that oftentimes people wait a long time to get aid in the home for whatever reason, and they've hurt themselves. Like the spouse, they don't know the mechanics of lifting somebody, so now they're
Injured.
impaired, they're injured. So that's something I can say as well in my experience. Now, what are some good questions to ask when hiring from an agency?
You're asking out of me?
Yep.
Okay.
And then we'll
And
put
I
it
didn't
to
know if I'm
Melanie.
allowed to chime in too. I'm being so quiet.
Which is so unlike you.
This is the
Yes.
quietest I've
We're gonna
ever
have
been.
to pull that tape off your lips soon, Mel. We know.
Yeah, you're next.
Well, I
You're
didn't know
next.
if
I
I'm allowed
promise.
to like interject or if I just wait my turn.
You're gonna go for the next question. I promise.
Okay.
Okay.
Yes.
So the ask me the question again. I
Sorry,
can't
the
hear you.
question.
Questions to ask when
Question to
hiring
ask the
from an
agency. Absolutely. Again, are you licensed through the state of New York? So important. You don't want one of these fly-by-night agencies. A companion agency, anyone can open a companion agency. Anyone. It's a little scary, but the state of New York does allow that. So if you're a companion agency, you might have absolutely no background in caregiving whatsoever, and you can hire anyone. You don't have to hire home health aides. You can hire, a good, compassionate individual, hopefully, but not necessarily a person who can handle what you need. They do not have to background check them, which is extremely scary. You're bringing somebody into your home. So ask them, are you a licensed New York State agency? Do you background check? I mean, if they say no, well, then they're not licensed. So you can kind of, you hope people are truthful right from the get-go. Do you background check them? How do you get your aides? Do you drug test them? Is there additional training? And then again, I'll go back to what I think the most important question is, do you have nurses on staff that can come into us at any time we need them?
Excellent. And so, Melanie, same question from your experience.
Yes, I would definitely say everything on par for, what we were discussing. Usually, no, I mean, it was pretty much everything she said, with everything else too, like leading up to this moment. But the main thing really is the certificate, because you want to make sure that they can provide that hands-on care. Because sometimes agencies, have companions and home health aides. The other thing too would be like the minimum of hours. So, we also at Allegiant have a 4 consecutive hour daily minimum, but we'll do a few days a week here and there. So you want to see, will they do 24-hour live-in? If it's a 7-day live-in, or are there more caregivers going in over time? And you could always ask about fee schedules. I mean, like we said, obviously, if you're paying somebody privately as opposed to an agency, it might be cheaper right now, but in the long run, it could cost you if there is a slip or fall or something like that. But just to ask if there are other payer sources. Are they only private pay? Do you work with Medicaid? So this way you don't have to change aides down the road if you are going to segue onto another payer source. So that's usually what I always, tell people ahead of time too. You could start with us and you'll be with us all the way through. So just something to keep in mind.
Great questions, lady. Great answers, I should say. So Melanie, can you talk to us a little bit about the different types of care? Maureen talked a little bit about transferring and companion care. Can you tell us from your experience of what different types of care that you've seen?
Sure. So it does start very simple, where it could just be that non-hands-on care, which would be meal preparation, light housekeeping. I always tell families, we're not going to get your house ready for a family gathering, but we do want to make sure that the area is tidy. There's no cords to trip over, that the rugs are neat, no waste around, dirty tissues, stuff like that. They'll do meal preparation. And again, it's typically for the person that we're providing the care for. But if they're going to cook an egg, they'll cook 2 eggs, but again, it's not a family dinner. It's usually more specifically for the person being cared for. Medication reminders. It's so important to be taking your medications appropriately. If they're not supposed to be taken with citrus or, different nuances, to make sure that the schedule and the medication is the right dose at the right time. Hydration reminders. Maureen brought up earlier before how UTIs, it's chronic with elderly people, especially if they have dementia, because there's an aversion to water and fluid intake, I guess. So you just want to make sure they're staying hydrated throughout the day. Fall management. We always say you can't really prevent, or we want to try to prevent falls, but if you just have to be careful that nobody's going to get hurt in the interim. So we try to manage the falls as much as possible. So sometimes, just to kind of be nearby, if they're using a walker, you can manage that. And then once you kind of segue onto needing a more hands-on care, then that would be those certified home health aides who can provide personal care. So that's your bathing, grooming, dressing. If they're using a toilet, commode, if they're on a catheter, you can clean around the catheter but not change the device. And if there's diapers involved, you want to make sure that somebody's being changed, or if there's a toileting schedule, there's many things that can be put in place. So if it's hands-on care, I feel like I could speak for most agencies. We really want to promote that independence as much as possible. So if you're taking a shower and you have a certified home health aide there, maybe one day they are washing your hair, but another day you feel a little bit stronger, then you can wash your own hair, but they're there for safety purposes. So it could be that hands-on or standby care. I think that's pretty much, there's also the ability to go into facilities. So if you're a licensed agency and you have a loved one who's in a rehab setting and maybe they're a little short-staffed, which seems to be an epidemic right now, and it's no one's fault except that there's just a shortage of caregivers. A lot of people can go into rehabs too. So if you're getting care at home, you wind up in a rehab, sometimes the caregiver can follow you into the rehab and be there as a liaison or, advocate.
Right. Excellent. Excellent. So you spoke about this briefly, and I know we've worked on it together many times, but Melanie, can you talk a little bit about who can cover the costs of care besides paying privately?
Yes. So there is the private pay component. There's also some Medicaid programs. So if somebody's applying for Medicaid for in the home, it's completely different than that chronic Medicaid that would be used to pay for a facility, whether it's, like a skilled nursing facility. For community Medicaid, there's kind of little steps in between. So first, somebody would apply for community Medicaid, and then depending, it can then enroll into a managed long-term care company through community Medicaid. So like Allegiant, for instance, does work with a couple of these MLTCs. So again, like how Nicole was saying, with all these acronyms all over the place, but the MLTC is who would pay for care in the home. They will do an evaluation, let you know how many hours you're approved for, and then Medicaid sends the authorization to the licensed agency, and then that agency can provide care under that authorization. If you're going through the process of applying for community Medicaid, you might have a pooled trust. That money in that trust can pay for more hours if you need additional hours on top of the Medicaid approved hours. There's also Department of Social Services. Allegiant has a contract with Suffolk County DSS, Department of Social Services, where we can accept that authorization to pay for care. And again, that number of hours is dictated by that department. So that's another way. There's also two, or I should say, waiver programs through the state. There's the NHTD waiver program, which I had to bring it up.
Transitional waiver program.
Yes, nursing home transition and diversion. And there's also the TBI, traumatic brain injury waiver programs. Those are also part of Medicaid. And typically that's to keep somebody who's a nursing home level of care that wants to stay in the community as long as it's safe and appropriate in their home. It has to be a private residence now because that changed. They would receive a service coordinator and have an agency doing the coordination and a separate agency who provides the care. So there's no conflict and interest with that. The VA, the veterans also offer different programs that cover home care. So we participate with both of those. There's a service disability connected pension benefit that will actually award hours through the VA. So the VA is billed, and long-term care insurance. So long-term care insurance is some policy that you would have taken out yourself that provides care while you're in home and an assisted living. And there's now riders you can have put on life insurance policies, but those long-term care policies are so valuable. They are worth their weight in gold because, you know, they'll really care. There's no limit. Oh, I shouldn't say that. Let me backtrack.
No,
there's a limit. There's a daily limit, but you get to decide how many hours you want. Somebody's not dictating the schedule as much because, you know, you can break it down and use it as you want to use it, is what I was trying to say. There's more flexibility. How's that?
Yes, potentially more flexibility.
There's sometimes a waiting and eliminating period, but everything that we're saying on this call, of course, you know, with this industry, there's so many different variables. So definitely speak to a professional about your particular circumstance.
Exactly. Thank you for
my
all
disclaimer.
of that. Thank you for all of that. And it's so true because and things change by the moment.
Yes, constantly.
So we all have to keep in mind that those are changes. There's changes in our life and our health. And there's also changes in policies and things like that. So at Care Answered, we can always help you find what's going to be most suitable for you to access your best care. And thank you so much, Melanie. Maureen, what about Bright Star? Do you take any other thing besides private pay? Like, do you take long-term care insurance?
So first, let me just back up for a moment. There are many serious situations that you might find yourself in, like a TBI that Melanie mentioned, a traumatic brain injury, that your Medicare recognizes that you need this help, and they will give you that ability to have a licensed agency in your home for certain conditions. TBI is an example of that.
Right.
We have TBI, clients. So sometimes don't think that you have to be on Medicaid to always get these, funding
Benefits. Yeah.
benefits for those particular issues, which is what Melanie said, speak to your professional, because we
Yes.
kind of know when Nicole, who can navigate anything, you know.
Mhm.
Also, many of our clients will also have been union people. Whether you were in the UFT, we work with the United Federation of Teachers all the time, whether you're police, fire, but other, you know, construction unions, and they have wonderful benefits that do have home care provisions. So, you know, you're not talking about your Medicare benefits, your Medicaid benefits, it's your union benefits that you have home care benefits with. So that's what, even though somebody says, well, they're a private pay agency, it doesn't mean that you are not covered, you know, through whatever insurance, specific insurance you have. Again, it's specific to your insurance. We deal with all the long-term care providers, insurance providers. And again, you need to know what's in your policy. Some of them are great, some of them not so, you know. It's a policy that you've been paying into, but when people will call us and say, what's my daily? You know, what's my daily rate? You know, how many hours of care can I get per day? What's my elimination period? Is it 30 days, 60 days, 90 days, where you're paying out of pocket before the policy kicks in? We typically say to them, well, you need to call your, you know, whether it's MetLife, Bright House, CNA, whoever it is, call them and say, what is my daily payout? Am I giving it? Some policies are generous, give it to them in a lump sum, and then the families use it the way they are. Some of them divvy it out on a daily basis, or whatever your needs are. So you really need to speak to that provider. Once you do, and you say, okay, you're using, you know, Bright Star, then that's it. Then we can talk to them. Once the person is signed off that we then are dealing with that insurance policy, then we take it from there. We don't even, we show the patient what they've paid out. You know, they get statements, but we take care of all the billing. So they don't even have to be bothered with, you know, writing their check or whatever. We deal directly with that insurance, with that long-term care policy. So
I was
there's
just gonna say,
there's
no,
all
we
these
do
other
as well,
benefits.
but some companies don't. So that should be another question. We go back to what questions to ask agencies, find out
Correct.
if they do assignment of benefits, or are you laying out all of this money and then trying to get reimbursed for it? So I think that's a great question to add back to the questions for sure.
Yeah, well, yeah, I have a dedicated person who just deals with long-term care insurance, you know, so
Right.
so we definitely, because we just feel it's easier for the client. They're dealing with whatever. And again, people want to see what's being paid out. So we send them the paid invoices every single month so they know exactly what was going on, but they never have to deal with any type of, you know, payment. So that's long-term
Right.
care. That's your union benefits. We have VA approved, so we deal with any veterans. We have several veterans that we're using. So, and if you do not have long-term care insurance, if you do not have benefits, if you do not have an insurance policy that either has your own personal rider on it or a union-based insurance policy, then yes, it would be private pay. And we try to work with you in terms of minimal number of hours that you do need. You know, some daughters are wonderful, but sometimes they're overzealous and say, you know, mom needs 12 hours a day. And then the nurse will go in there on assessment and say, not really, you know, let's scale it back a little. Maybe you have to build up to 12 hours a day, but sometimes then you don't need that in the beginning. You know, all schedules can be tailored any way you need.
Perfect, perfect. And one of the things to note that I've worked with them as well with is at Care Answered, we review your policy and help you put up your claim so that we make sure that you get the benefit that you've paid into. So it's really good to know which programs do indeed take it, because not everybody does. And these agencies do, so it's wonderful. So and it's also great that you mentioned all of those other things, because I've had the same experience as you have, Maureen, with NISHIP and getting all sorts of wonderful benefits that people truly
NISHIP
need.
is
And
excellent.
it was only because they had that insurance that they were able to
Exactly.
get it.
Exactly. Also, though, I think it's important to mention, though, that if something falls under a skilled need, like I think Mel, you mentioned before about, you know, or maybe you did in your slide, Nicole, about speech and physical therapy, speech therapy, occupational, that's a skilled service. And so your Medicare, you know, kicks in for that when you are discharged from the hospital or rehab. But there are other home services that are considered skilled. Like wound care, and we do infusion care. You know, for people who have need infusion medications and they don't want to go to a center, they have that in their home. Your Medicare kicks in for that as well. So that's why it's important to know the differences between companion care and personal care and what a skilled need is.
Yeah, absolutely. And thank you for sharing that, because I know that Bright Star is one of the few that do offer that. Not every agency offers that. And it's really good when you know the questions to ask and you know the needs. Obviously, both of these agencies and most home care agencies will do an evaluation, of course, but to make sure that you yourself as a caregiver or as a patient know what your needs are, so that you're asking those questions so you can find your best fit. Are there any other questions that we might have? I don't see anything in the chat, but if you have a question, please feel free to come off mute and ask them. Are you nervous? No, they were just so very thorough in their answers. Do you, Maureen or Melanie, do you have any kind of things that you feel like, oh, people should know this and we didn't get to cover it? Do we feel like we missed anything?
Well, I like the fact, Nicole, that you just mentioned the assessment. When you call an agency and you don't know the questions to ask, you just don't know sometimes. I mean, we can educate you. You can feel like you are educated. Sometimes you go blank when you do call an office. We have extremely trained, and Mel does, and Allegiant as well, intake coordinator, CCRMs, we call them, customer, what does that stand for? Another acronym?
Yeah. I was like, I am that person at Allegiant, so I speak to everybody individually.
I'm not, but I have some wonderful CCRMs, and they will ask the right questions of you to get you in the right direction and to get you to the right place. But then our nurse goes in to do an assessment, and even if it wasn't something there that was talked about on the phone, at that assessment, she will discover what all the needs are. Sometimes call the CCRM and say, why didn't I know this when I went in to get everybody in the right place? So don't panic, because I would hate to think that someone did not pick up the phone to call an agency because they wanted to do more research to make sure they knew the right questions to ask. Don't do that. Don't do that. Right. Just pick up the phone, call us, and we will navigate you through the whole process and see what the situation is.
Absolutely. Melody, did you want to add to that?
No, I was going to say the same thing, because it's with the care plans. So as these care plans are being created by the nurses who come in to open up their charts, that is when they really get into the nitty gritty about everything, like likes, dislikes. Do you try to give somebody a shower in the morning, but their entire life they take the shower in the evening? Something you want to talk about and make everybody feel as comfortable as possible. Right. Also, too, another thing, say, that an agency sends in a caregiver and you're not too thrilled with that person, or the opposite, you absolutely love that person. Please share your feedback with the agency, because we want everyone to feel comfortable when that person's coming into the home. So you can always ask for a replacement. You can ask for that person to always be there because you absolutely adore them. But just always keep that line of communication open, and don't wait like for months and then be like, oh, well, so-and-so, wasn't doing this, that, you just communicate. That's the key part to the whole home care piece, is always communicate your wants, your needs, your opinions, but nicely. And respectfully. But we want to accommodate, we want to try to get the schedules to fit and to have it work out for everyone. And like Maureen said, sometimes you just need to kind of start off with baby steps, and then you can increase your schedule, because we understand that the needs change, schedules change. But again, just coordinate that with the home care agency.
Absolutely. And communication is key everywhere. And I think one of the things that both Maureen and Melanie bring is that available communication to all of their colleagues and clients and coworkers. Because if you're really not getting anywhere, if people aren't communicating with you, I say this all the time in all forms of healthcare, communication is key. If you're not able to communicate your concerns, then you're not accessing your best health. So just that should be one of the questions that you should ask too, just to add to the questions. Who is there going to be somebody that I can speak to? Who would I go to if I am concerned besides the aide themselves? So that you know that, and so that you have that peace of mind. And again, you can certainly work with Care Answered if you have any questions about what to ask. We do these webinars and have these experts like today, and we have blogs so that you can be empowered patients and advocates for yourself as well.
Mhm.
So anything else? Let me just check the chat again. Oh, thank you. Thank you, everybody. They were thanking you for a wonderful presentation. So thanks, everyone. And we'll be here next month with Medicaid updates, community Medicaid updates, and speaking with the theme of care in the home. So look out for that, and have a wonderful holiday season, right? And we'll see you next time. Thank you. Thank you so much, Maureen and
Thank
Kim
you.
and Melanie.
Thank you,
Thank you so
Nicole.
much.
All right.
All
Bye-bye.
righty. Bye-bye, guys.
Bye.